This video is about COVID-19 caregiver protocols. How to protect yourself from the virus as a caregiver. According to the studies conducted on COVID-19, it has been concluded that it definitely spreads through the respiratory droplets that are emitted from an infected person's mouth after they might sneeze or cough. And wearing a mask and maintaining a distance of at least 6 feet (2 meters) is an important preventative measure to protect yourself from the infection. As a caretaker, you are at greater risk for the infection, since you are continuously in close proximity to the virus, and must try your best to keep as much distance and take all the necessary precautions that you can. Moreover, a caretaker of someone who has been infected with COVID-19 must not themselves be at higher risk to the infection and its complication by already suffering from a long-term disease or belonging to an older age group. 1. Keep your distance from the infected person. As mentioned earlier, maintaining distance from those around you who may be infected with the virus is key to prevent getting infected with the virus yourself. To implement this, a safe distance of 6 feet (2 meters) has been recommended to be maintained between yourself and others around you, whether or not they are showing symptoms for COVID-19. However, if you are someone who is taking care of a loved one or family while they are infected with the virus, maintaining a distance of 6 feet (2 meters) may not be possible at all time, but you should still try to keep as much distance as you can, while following all the recommended SOPs and wearing the personal protective equipment. 2. Wash their used utensils using gloves, dishes, glasses, or spoon that an infected person has used may contain the viral particles due to its potential contact with their mucosa or salivary fluids. If you as a caregiver were to touch these utensils, you may also come in direct contact with the fluids containing the virus, and in turn, get infected as well. Hence, it is highly recommended that you use disposable gloves while managing any utensils that may have been used by the infected individual, and then immediately dispose of the gloves off and wash your hands. 3. Wash your hands even after taking off the gloves. There are a variety of gloves available in the market, depending on the material they are made with, their permeability, and the thickness of the gloves. While some allow more to pass through it, the others may completely block the fluids and matter that may be present on them. Hence, it is highly advisable that even after you take off your gloves, you should ideally wash your hands, as there is always a risk of some of the substance passing from the glove onto your hands. 4. Refrain from sharing things with the COVID-19 infected individual. The rule after you find out that someone in your house is infected is to stop sharing things with them. The first of these should be the room, which should be separated immediately, and the person should be left in isolation for at least 14 days, or until their symptoms start to subside. However, this is not just limited to the room, but to other household things as well, like electronic instruments, hair irons, bed sheets, clothes, or scarf. 5. Wear a face mask. When taking care of an infected individual, you are most likely going to be in close proximity to them most of the time. This is why it is essential that one must wear a mask at all times to prevent coming in contact with the droplets emitted from their mouth or nasal passages. The gold standard for masks is the N95 mask, due to its superior filtration quality, and one must make sure to wear these whenever you are in the same room as the infected individual. 6. Maintain good hand hygiene. Even if you wear a glove while performing chores around the house, it is an absolute must that you wash your hands after taking off your gloves. This will ensure that even if something passes on from the glove to your hand, it will be washed off before you touch your hand to your nose or mouth. Moreover, you should also try to wash your hands after you touch anything that may have been previously touched by the infected person, as it may contain viruses containing particles on it. If you are somewhere where you don't have access to flowing water, you may always use a hand sanitizer that has at least 60% alcohol, as recommended by the CDC, to get rid of the disease-containing germs from your hand. 7. Prevent touching face as much as you can. Most of us touch our faces numerous times in a minute. Whether it is to tuck back our hair from the face, to scratch an itchy point on the face, or even out of habit. Furthermore, you are more prone to be reminded of something when you are not supposed to do it. Even since the start of COVID-19, it has been instructed by the health authorities to prevent touching the face with your hands, as they may be infected with the virus-containing droplets, and bringing them close to the mouth or nose will further facilitate the entry of the virus into our body. This is particularly important when you are a caretaker who is taking care of someone who is infected with COVID-19. Every utensil that the infected person uses may be infected with droplets containing the virus emitted from the respiratory passages. Since you will be most likely managing these utensils, even if you are wearing your gloves, touching these to your face can easily cause the transmission of the virus to your system, and you are likely to get infected. 8. Disinfect around the house. When someone in the house is infested with COVID-19, you must try your best to decrease the viral load of COVID-19 from the house. One way to do this is to disinfect as many surfaces as the house as you can, even those which may have not been touched by the infected person directly. The surfaces that particularly need daily disinfection are those that are frequently touched by not only the healthy residents of the house, but also the guests and outsiders which appear asymptomatic. They include the doorknobs of the front door, and all the bedroom doors, kitchen slabs, stair railings, and any handles that may be present in the house. 9. Monitor your own health. As a caretaker of someone who is already infected with the virus, you are at higher risk to get infected with the virus, and must constantly monitor your health. You must note down any changes of symptoms that you may experience, no matter how insignificant or minor they may seem. These may include fever, cough, dryness of throat, changes in the voice, sleep changes, or shortness of breath. An early diagnosis will allow you to start working on your health and symptoms earlier, and also prevent being a source of transmission to others around you. 10. At home after completion of care. It is recommended by numerous health authorities that even if you have not been infected with the virus yourself, you must quarantine yourself at home for at least 14 days. If you have come in contact with an infected person recently, this is because the virus may not present itself immediately in the form of symptoms, and in your symptomless state, you may be causing the transmission of the virus to others around you. Moreover, it has also been reported that some individuals remain completely asymptomatic even though they have been infected with the virus. And these are the cause of the most spread of COVID-19 infections. A quarantine period after your contact with an infected individual will allow the virus to pass out of your system if you have been infected with it. We hope these tips would help to reduce the spread of COVID-19 infection in our communities. Note: this information is for education and reference only. It is not meant to replace the informed advice of your doctor. If you believe that you have a health problem, Please, consult your doctor, or health care provider. Do not resort to self-help. Here ends this video on COVID-19 caregiver protocols. Don't forget to check out the other COVID-19 videos on this channel. If you found this video valuable, like, comment, share, and subscribe to receive alerts when we produce these types of videos in the future. Subscription to our YouTube channel is totally free. Thanks for watching. We hope you enjoyed this video. See you again soon.